name is Efrain Talamantes. I'm an assistant clinical professor at UC Davis in the Department and Division of Internal Medicine. And I'm also the co-director for a Center for a Diverse Healthcare Workforce. One of my passions is diversity and ensuring that we have a more diverse healthcare workforce. Coming from an underrepresented background, as a Latino, as one of the first in my families to get an education, and I had the opportunity to go to college, I really began to understand that there are healthcare disparities, specifically for Latino patients who are uninsured or often can't find a doctor who speaks their language or understands their culture. And so diversity to me is personal. It's really about increasing the underrepresentation of students who share the patient's backgrounds, because it will ensure that we have a more culturally and linguistically responsive workforce. And that means better care. That means better care for our communities. It means that we can ensure that they have good outcomes, meaning that their health will get better, that they'll live healthier lives, because we will be able to take care of them in a more sensitive way. I think it's hard to understand diversity when many times we don't spend enough time learning about it. Diversity oftentimes can feel exclusive. It's sort of, well, only if you're a minority you should be part of diversity. But the reality is the diversity is very encompassing. It's very inclusive. It ensures that people that need to be at the table are included in important discussions and decisions, especially when it comes to healthcare. And so without diversity, we will not adequately provide good care. So I had a interesting experience in high school. I actually, there wasn't enough room in ninth grade algebra, and I was held back because of that. And so I wasn't going to finish college prep, my college prep math courses. So I had to go to community college as a high school student. And community college really embraced me. The people there were incredible mentors to me. And it allowed me to be better prepared for college. So when I got to the University of California, Los Angeles, I felt like I had an extra edge because I had gone to community college as a high school student. But one thing I started to notice is many of the students that I mentor go to community college. These are largely underrepresented in medicine students. And oftentimes they had a lot of questions about going to medical school, and no one was really providing them with answers. And so I said, well, I want to know these answers. And so I've used my own, made it my own personal mission to ensure that community college students have the information and the resources they need if they want to go to medical school or become other healthcare professionals. And we need them all. So I think that the community college pathways offer a very important population of students that we need and we want to see in medical school. Yeah. Well, we know if you look at the data that community college students by far are more diverse, meaning they come from a variety of backgrounds. There's more women. Many of them are low income. And so these are the types of students we need because they reflect our patient population. So these students understand what it means to have to use a public transportation system, grow up in underserved communities. So not only do community college students offer an opportunity to provide more cultural humility or humble care to our patients, but care that our patients really look for. Community college students are also very resilient. They've gone through a lot of challenges. They will not back down from, in my experience in mentoring them, from the odds or the obstacles. And so this is the type of students we need in medical school, students who will go above and beyond to provide good care to their patients.